Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Infliximab. Infliximab is a chimeric monoclonal antibody, and this monoclonal antibody it is IgG1 type. It is a tumor necrosis factor alpha blocker. It can be given as an IV infusion, and this infliximab is a longer acting with half life of around 10 days. The uses of infliximab is it is used in rheumatoid arthritis, Crohn's disease. It is used in psoriatic arthropathy, sarcoidosis, and Wegener's granulomatosis.
thank you and thank you for watching.